My name is Dr. Buonassisi, and I'm a board-certified facial plastic surgeon with a practice in Vancouver, Canada. I've been specializing in cosmetic rhinoplasty for almost 20 years, and I'm here to answer your questions about this very interesting procedure. Happy patients are educated patients, and that's why every question is a good one.
So what are the healthy and unhealthy expectations for rhinoplasty surgery? So first of all, let's talk about the healthy and realistic expectations for rhinoplasty. The first is better balance, just to give a better balance between your facial features. So the position of your nose relative to your chin and your forehead is an example of that. An improvement in appearance is another goal of rhinoplasty. And what we're trying to do is make small changes to some of your nasal features so that your overall aesthetic look improves. The next is shifted focus. If you have a nasal feature that is very prominent and catches the eye in all directions, taking away that prominent feature can make it much easier to see your other features and often is much more pleasant. While rhinoplasty won't change your life, it can improve your self-confidence. Worrying about one of your facial features or negative thoughts about that can certainly take away some of the energy from your life. And I think that toning some of those features down or making a change to a feature that you don't really love can often help. So now let's talk about unhealthy expectations for rhinoplasty. The first is a perfect rhinoplasty. There's no such thing. On close inspection, there's always some evidence that a surgical procedure has been performed, whether it's a more prominent cartilage or an irregularity along the bridge. There are certain maneuvers that need to be performed in order to achieve results with rhinoplasty. And if you look very closely, you may see some of those. And it's just not possible to have an absolutely perfect, flawless rhinoplasty. Rhinoplasty is not a mathematical equation. There are many decisions that need to be made during a rhinoplasty surgery and also beforehand in terms of planning and what's going to look good. And you really have to trust your surgeon to make good judgments about what your nose should look like and also how your nose will function after surgery. Those two don't always go together. As an example, narrowing the tip of your nose might look good, but may make it difficult for you to breathe. So you do have to have trust in an experienced rhinoplasty surgeon. While it's perfectly reasonable to expect an improvement, you should not expect perfection. Another unrealistic expectation is to have a drastic change to the shape of your nose. First of all, that rarely ever looks good. And second of all, it's often not possible. Your nose has a physiologic function. The bones and cartilages need to hold the skin up so that you can breathe through the nose. No surgeon in the world can make a drastic change to your existing nose without having some physiologic consequences. The last unhealthy expectation is that rhinoplasty is going to change your life. It won't. It's going to change your nose. It's going to make you look better if you have the features that can be corrected. But if you're expecting that rhinoplasty is going to get you a better job or improve your situation in life, that's not realistic. If you're considering having a rhinoplasty, my most important advice is to have a consultation with a very experienced rhinoplasty surgeon who's going to give you good, honest advice.
Thanks for listening, and check back regularly for new questions and my honest answers about rhinoplasty.